why do we have all these balls in the first place? Let's talk about this. Like, how do we get in the situation to begin with? So first thing is that as a public health person, we tend to put others' well-being over ours. So I have been doing HIV advocacy since the 90s. And one of the things was when I started to kind of feel tired and feel like something was wrong, my brain would be like, but you have full health insurance, you have a full job, you're not struggling to try to figure out if Ryan White's gonna pay for this. I remember going to an advocacy meeting and one of the women with HIV kind of lived in my neighborhood, and I was about to go home and get on the metro, the train system we have in DC, and it's about, I think the ride was like, $3 or $4 or something like that to get from where we were to where the stop we were going to. So I started walking to the metro and she keeps walking, and I was like, hey, aren't you going this way? She's like, I'm taking the bus, because she could not afford to ride the metro. So for me, I'm like, well, I have all of these privileges, so there's no way I can be tired. I don't deserve a break because I'm not worried about my health and livelihood every day. And so that was the mental talk in my head, and for a lot of people in public health, is that people who are like professionals in public health, we're like, we see all of our clients, we see our patients, we see the community and what they're going through, and we're like, well, how can I be tired with all of my privilege? So I often use that as an excuse to not take care of myself.